For millions of pregnant people, the birth of a child is supposed to be a happy and fulfilling time. Yet for some Americans, their experience in a hospital maternity ward is anything but that. The CDC is now urging healthcare workers to guard against mistreatment. Tonight in our Prime Focus, ABC's Devin Dwyer talks with several women who tell their stories of profound trauma while giving birth. They are now seeking justice and searching for solutions to a system they say has left deep wounds.
I wanted to die. I was negotiating with God, how long I would have to live.
The most happy moment in my life is at the same time the most terrible moment in my life because of what they did to me.
I'm getting a contraction. He comes near me with the scissors and starts slicing at my vagina 12 times.
They are stories of profound trauma while giving birth.
The nurse puts her hand on the baby's head. And I could feel that pressure of her preventing the birth. I'm sideways, trying to push away, fighting against my nurses. And that's what caused my injury.
Injuries with emotional and physical scars.
I told them not to cut me. I have 3 medical conditions because of what he did to my body that day.
I couldn't move. I was restrained in that position. I said no. Nobody cared.
Jane Doe would only speak in silhouette to protect her family.
Why are you wanting to share your story?
I want nobody to have to endure what I have to endure because it's so terrible.
This mistreatment is very troubling.
Dr. Deborah Howery, the CDC's chief medical officer, says mistreatment in American maternity wards is a systemic problem.
We need hospital systems, providers, and communities to really be aware of this, because there's many things we can do.
A CDC analysis of a survey of new mothers includes reports of ignored requests for help, women being shouted at or scolded, violations of physical privacy, and threats to withhold treatment or made to accept unwanted treatment. Dr. Howery says the experiences can directly impact the health of a new mother and may contribute to a growing number of maternal deaths in this country, especially among Black and Hispanic women.
What does it say that the CDC has to issue guidance to healthcare providers to be respectful?
I think what it says is, potentially in a stressful moment, there can be unconscious bias that comes out, and this is why we need to be more cognizant of it.
If the CDC has to tell you to respect patients' rights and to respect the medical ethics of autonomy, I think we've really gone off the rails.
Julie Cantor, a doctor and attorney who represents Jane Doe, says there's a culture of silence and stigma around maternity mistreatment that's compounded by legal barriers to holding providers accountable.
Cases are generally very hard to litigate and they're expensive. And so if the mom's harmed but the baby's fine, why is that worth any money? And it's a system that's built around moving money, not just fixing problems.
Caroline Malatesta knows the challenges firsthand after a traumatic birthing experience in 2012 at Brookwood Baptist Medical Center in Birmingham, Alabama.
My expectations were that I would be able to move around the entire time.
Being able to be in any position, right? I mean,
be in any position for birth.
And to have some autonomy.
Yeah.
Instead, Malatesta says she was subjected to physical restraint.
They pulled me to my back, flipped me over, and I remember the pressure on my back being so intense that I lifted my right leg and even pushed against the nurse's neck, just trying to fight to get back over.
To be physically fighting with your caregivers.
Mm-hmm.
I mean, how are you even making sense of that at the moment?
At the moment, I was not making any sense of it. The hard part came after, when everything's quiet, everyone goes away, and there's a sense of betrayal.
There's a photo of you and your husband and your newborn son shortly after all of this happened, and you look in pain in the picture.
I was in shock. I was in shock more than anything at that point.
In the months that followed, Malatesta says numbness turned into debilitating pelvic nerve pain and PTSD, all of it taking a toll on her ability to parent and on her relationship with her husband.
Good to see you.
Her search for accountability led her to Kristen Pascucci, a birth advocate in Kentucky who was quietly building an archive of stories of birth trauma online on her site, Birth Monopoly.
I've heard thousands of those stories. Caroline just ended up with a really bad permanent injury. But all of those things that happened in her birth, they might have happened and not resulted in an injury that allowed someone to bring a lawsuit, but the mistreatment itself is still ongoing.
Malatesta sued her hospital for medical negligence and reckless fraud, and in 2016, a jury delivered a landmark $16 million judgment in her favor, putting mistreatment in the maternity ward into the national spotlight.
There's a lot of gaslighting that goes on when anybody has anything to say about their birth other than it was beautiful, it was wonderful, it was great. But the bottom line is, mistreatment is not necessary for safety.
The jury's decision might have been rare, but instances of birth trauma are not.
No, don't cut me.
As her mother filmed the delivery of her first child, Kimberly Turbin is heard questioning the need for an episiotomy, a cut made to the vaginal area meant to ease delivery.
Why? We haven't even tried.
Video of the procedure, which she says the doctor performed against her will, has over 1 million views on YouTube, generating a groundswell of support for Kimberly that she says inspired her to seek accountability.
He doesn't tell me what my options are. He never mentions that the baby or I am in distress. He came in with authority over my body and told me that he's gonna cut me.
When did you decide you needed to speak out?
He called me the day that I was released from the hospital and said if everything's fine. I said, actually, everything is not fine. I'm in a lot of pain. I can't walk, I can't sit.
After speaking with dozens of attorneys who declined to take her case, Kimberly Turbin filed a lawsuit against the doctor on her own. She settled her case in 2017 and now helps other women seek justice.
A lot of obstetric violence can be very kind. You don't even know you're being done a disservice because obstetric violence doesn't always look like my horrific birth video.
The American College of Obstetricians and Gynecologists says a pregnant patient's autonomy should be a doctor's top priority, saying it is never acceptable for a provider to compel a recommended treatment for a patient or unborn child. While life or death emergencies often require urgent medical interventions, ACOG says it is imperative that pregnant and postpartum patients feel comfortable communicating their wishes.
How do we fix this problem?
Certainly training helps to understand what are some of those biases that we all have.
Training medical professionals is something Kristen Pascucci, the CDC, and other women's health advocates are working to provide. But she and Caroline Malatesta say there also needs to be a fundamental shift in how society thinks about birthing persons at their most vulnerable moment.
Women feel like, well, if I talk about what happened to me, it shows I'm just selfish because I wanted my birth to be a certain way, when really I should have been thinking about safety of the baby. And women have these birth plans because they care about the safety of their babies.
It doesn't have to be this way. It is just a matter of making the decision to change what we do.
Hopefully change is on the way. Our thanks to Devin for that important report.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.